test track trace plan provided this week. Okay, thank you, Larry. The next couple of questions are from James Crichton-Smith from ITV Wales.
Minister, thank you. The ONS stats out today appear to indicate further that we're past the peak. But how confident are you that you're getting a real-time picture of the virus in Wales, given that, capacity aside, you're still testing so few people compared to what you'd originally intended?
Well, the testing has a point and a purpose within our plan to keep people safe, but it's not an end in itself, and it's not the only mechanism to tell us how the virus is circulating. We, of course, look at a range of other measures too, and you'll be aware, James, that in the written statement and the summary of our scientific advice on the R figure that we published on the 8th of May, it set out a range of measures that we look at to help us to understand the R figure. And those include things like the take of our critical care capacity, but also hospital admissions as well. So we have a range of different areas. It's not just about testing, but testing surveillance obviously has a role. And obviously you heard in my statement the work we're doing with scientists at Bangor University to have a different way to try to understand the circulation of coronavirus and the peaks and troughs within it in different parts of Wales. So, as I've set out, testing has a point and a purpose. We've got a testing strategy. Later this week, we'll have a test track trace plan, and we'll continue to monitor a range of data and information that is much more time sensitive to tell us what is happening with the R figure across Wales and in different parts of Wales.
Elsewhere, the Chancellor is setting out changes to the furlough scheme across the UK. It's helped many Welsh businesses, but do you accept that as the lockdowns ease over the coming weeks and months to come, the scheme also needs to change too?
Well, I think there are two different points to make here. The first is that we've made direct representations to the Chancellor for the furlough scheme not to end at this point in time. We think there'll be a backward step. It's been really important at keeping individuals and businesses going, and a premature end could do real harm. The challenge then is at what point in time would it be right to reconsider the scheme? Because it's been a measure in response to the crisis that we face and in the fact that we've had to close down large areas of public and private activity. So yes, at some point the scheme will need to change, but that's got to be based on the evidence. The evidence of where we are and how safe it is for more people to go about their business and to return to work, for workplaces to be safe for people to go back to work, and crucially to understand on a regular basis at each stage of unlocking the lockdown across the United Kingdom, what that means for the R figure, so we don't take a big broad step forward that forces people to go back to work, and then we only understand the impact of that a few weeks later when it could be too late in terms of the sense of there being a further spike in activity. So the evidence has to guide our approach rather than having a date at which the scheme will end that doesn't relate to real world evidence of what is happening. Thank you, James. We've got Mark Smith from Wales Online.
Thank you very much, Health Minister. Public Health Wales's latest survey of the Welsh public shows a decrease in concern for becoming infected with the virus. What do you put this down to? And do you think the messaging around staying at home needs to be strengthened in Wales, particularly as England has veered away from it?
I think there are a number of reasons here, and that the difficulty is in how we try to forecast or add in reasons about what might be happening without understanding what the public are saying. We're going to take regular surveys of opinions in Wales about people's attitude to lockdown and how people self-report their own adherence to the rules as well. So we know that there's still a very high level of support in Wales for the lockdown rules, but there's also a very high level of compliance. But some people are getting restless about it. And I understand why that is. It's a very difficult thing for all of us to have to do, myself included, of course, but we're following the rules for a purpose, and that is to make sure we avoid the direct harm we understand COVID-19 causes. As I said in my opening statement, 1,100 people at least who are dead. Now, when we talk about the difference of our approach in Wales and England, we're of course concerned about the very different approach across the border and the messaging and what that will do to behaviour. Our police forces are equally concerned as well. This weekend we saw more people moving. We saw a significant increase in fixed penalty notices across Wales for breach of the rules. So we can understand that behaviour is changing, and those people who are breaching the rules are largely people from Wales as well. We want to make sure that we encourage our own citizens to follow the rules as we've set out, because the point and purpose hasn't gone away. And equally, we need to send a clear message to friends across the border in England. We want you to visit Wales later. You should not come to Wales for leisure or for exercise if it isn't local. And it's very clear that travelling from Kent to North Wales is not local travel. Travelling from Hereford to Pen y Fan is not local travel. It's really important that message is understood, because it will be policed and it will be enforced.
Thank you very much. And secondly, the Welsh Government announced earlier this month that testing will be offered to all care home staff and residents where someone is showing symptoms of coronavirus. How is that currently testing being carried out?
Well, I can't give you the exact detail on the reporting from symptom to testing being carried out, but we do know there's been a significant upswing in the amount of testing taking place in the care home sector, both staff and residents. Last week on our figures, we've seen a 3- or 4-fold increase in testing in this particular area, but I know that it's inconsistent. There are some parts of the country where there are anecdotes about that testing not taking place in accordance with the policy I've announced. So I've been very, very clear and direct within our healthcare system over the last few days. I expect that testing to be carried out in our care home environment where there's a confirmed case or a suspected case, and I expect that to be done in a consistent way. I want to see the anecdotes of where testing isn't being provided in that way levelled out rapidly for the immediate and consistent implementation of the policy that I've announced. And I am, of course, making sure that I'm checking up with not just elected representatives who raise calls with me, but to see in the figures if we're showing that direct and deliberate use of the capacity that we've had a significant increase for and the point and the purpose of it. And I hope that next week you'll see further evidence in those figures when I come to speak to you again, Mark. Thank you. We've now got Adam Hale from the Press Association.
Sorry, thank you, Mr. Gething. The First Minister said yesterday that he didn't think England were getting it right in terms of easing their restrictions, adding that what was happening in Wales would hasten Wales's exit from lockdown. Does it follow then that at the moment, Wales and England moving out of lockdown at different times has never looked more likely?
Well, I think it's important to recognise that we've taken a consistent approach, and our regulations still have the stay-at-home message at their core. It underpins our approach to the new laws that we've introduced to both stop harm, but then to have guidance to help people understand how they need to follow the rules. Now, we think that the messaging in England is confused. The Prime Minister acknowledged as much yesterday in questions that he answered. We think it's really important we do have much greater clarity in our message and consistency where possible. That's why we've called for regular and predictable meetings of COBRA at head of government level to make sure that we're discussing these matters earlier. Because we do think that where we have those conversations, they make a difference. I have a regular conversation with other Cabinet Health Ministers. It's a good way to share information, but also to have honest and frank conversation that have helped us in making choices in each of our respective countries. That approach through COBRA, chaired by the Prime Minister, I think would help to resolve a number of the issues that we now face. It's possible that even with all those conversations, each part of the United Kingdom may move out of lockdown at slightly different points in time. We would understand why, we were able to share that evidence and that approach, and I think we'd all be in a better position to provide the consistency that I know that people are looking for.
Thank you. And you said the Welsh Government have made representations to the Chancellor regarding the future of the UK Government's job retention scheme. But were the Welsh Government actually consulted about it? I.e., did the UK Government actually seek input from Wales ahead of today's announcement? And can you set out what would be the wrong message from the Chancellor later this afternoon?
Well, I can't tell you the exact details of how proactive the UK Government asked for views from the Welsh Government, but I'm very clear that ministerial colleagues have made direct representations to the UK Government. about the need to continue with the furlough scheme. It's really important that it doesn't change now. It's important for individual employees. It's also really important for individual businesses that that support is not reduced at a time where we're nowhere near ending lockdown. And I think the wrong message would be if there was an arbitrary date created to say that the scheme will end at a point in time when we don't know and we can't be sure what the progress of the virus will be at that point in time, and equally the measures that will need to be taken by businesses and their employees working with their trade unions to make sure those workplaces are safe for their workers and indeed the public that may use those businesses. So I think there's got to be no move away from the evidence leading the approach rather than a date-driven approach to wanting to unlock more activity. Because if we get this wrong, then a further return to lockdown would be much more difficult with much greater harm caused to people. It would also do very real harm and unnecessary harm to the economy. Thank you. Adam, we've now got Rob Taylor from Wrexham.com.
Lately, we've been seeing the internal dashboard health data for North Wales, and one subset shows data for people with confirmed COVID-19. That is current inpatients, discharges including deaths, and in-hospital deaths. That information is totaled and split between the West, Centre and East. Previously, Welsh Government had promised to share more data as and when you can, while pointing out that that will not happen if people can be identified. Now, the figures that we've seen are anonymous, and the totals are well above the previously stated Public Health Wales anonymity boundaries, and some of this data is already public Wales-wide, and you've referenced some earlier. Why won't you make the more localised anonymous data public and let people know what's going on in their localities and perhaps reinforce the reality of the virus?
I think we're being really open. We're publishing more and more information. We had a significant publication of the scientific evidence recently. We've given indications already of the number of people that have recovered from coronavirus, and we'll continue to look at what information we have and how we can make more of that information available to help inform the public, because I think the more information we can give the public about what's actually happening, the more likely people are to both follow the rules and understand how and why governments are making really difficult choices. I'm not aware of all the detail that you're expressing about information in North Wales, but I'm more than happy if you or others want to contact the government with suggestions on how we can make more information available for us to consider those, to make sure we're providing useful and robust information that really is informing, not alarming the public.
On the same dashboard, it shows the discharge destination for patients and if they were tested and the outcome of that test as well. And one of the data sets that we've seen shows 343 people listed as discharged to a non-NHS residential care or nursing home, with just 63 of those 343 people tested and one confirmed case. Bearing in mind coronavirus can be asymptomatic, as you stated earlier, are you just kind of crossing your fingers and hoping that the 280 untested people and people like them don't have COVID-19 before discharging them to the care sector?
Well, I think it's a classic case of not being able to answer a question, you don't understand the data that you're referring to and the time frame over which it is, because you know that we changed our policy on discharging people from hospital into the care home sector, at which point tests would be done. That should be done on all people now leaving hospitals to go into the care home sector, so you're going to expect to see more consistency on that. And that wasn't because the evidence said that we should do that. It was actually about maintaining confidence within the care home sector to make sure that the system doesn't freeze. Because actually, if we can't discharge people from hospital, then harm will be caused to those people who are staying in a hospital bed when it's no longer the right place for their care to take place. So we'll want to make sure that we maintain confidence in our whole system. And again, this point about having a transparent approach to data is exactly where we are. There's certainly no crossing of fingers when it comes to our approach on coronavirus. For all the difficulties, we still have to have an approach that is founded in the evidence and doing the right thing to keep as many people safe, well and alive as possible. Thank you, Rob. We've now got Tom Magner from Carers World Radio.
Thank you very much indeed, Health Minister. If you have a family carer in Wales who normally would have a job to go to but doesn't at present, and their employer is seeing what's happening in England and the encouragement to go back to work, and so the employer is pressurising them into going back, but they haven't got the home care support in place, what's your best advice in those circumstances?
Well, we know that this is some of the confusion that's created from different messages in Wales and England, but it's really important that people follow the rules that we've set out. Our starting point here is to stay at home. Some parts of the economy, though, have always been open, and it's always been a permissible reason for some people to go to work. those people should discuss with their employer the arrangements that are in place. And it's difficult because I think if there's a message that people are being compelled to go back to work, that I think causes real confusion and upset for people. But you'll have seen the message not just from the Trade Union Congress, but also from the CBI as well, that businesses should talk with their employers about arrangements and make their plans in place to understand how they're managing risks with COVID-19 within each workplace. And in Wales, we're really clear that the social distancing rules do apply to businesses as well. And so it's important that people have that clarity. It's important that people have that level of understanding and confidence. They're not being asked to go into an unsafe workplace.
And can I just move on to the subject of care home deaths? We've got the ONS figures today, which are suggesting around 40% of deaths are occurring in care homes. How robust do you feel is the system for transferring people from hospital into care homes at the moment? Well, not only robust, but how safe?
Well, I think we do have a robust and a safe system. As I said, to give confidence to that system, we've made sure that we're testing people who are leaving hospital to go into care homes. We've also put some money into it to help people in the discharge process. Before the pandemic started, a large part of our concern was that too many people were staying in hospital for too long and weren't being supported to go back into their own homes. And that person's home could be a care home. It's an environment that's familiar, and actually you can get deconditioned, as we understand, if you remain in a hospital bed longer than you should do and you're not as mobile and active as you should do. So it's both about activity within the hospital before people get discharged, is about making sure they are discharged to go back to their home with the support that they require. And that's why we invested more money in doing that during the pandemic. But we of course need to understand what's happening within the sector. That's why we're spending lots of time, energy and effort on speaking, for example, with Care Forum Wales. I was in a conference meeting that I chaired yesterday with their chief executive to understand how our testing regime helps to give that confidence, that the consistency and message about what should happen is being delivered and is being acted on. And equally, where there are challenges, that we understand them so that we can address them. I certainly wouldn't want anyone to think the care home sector is unsafe for themselves, but equally that's about the practice within each of the homes. The guidance that we issued is really important to both reduce the transmission into care homes. That's why we had restrictions on visitors. The challenge about staff going to care homes, making sure that they're cared for, to make sure that the environment within the care home is cleaned on a regular basis, and the basic point about infection control and good hand hygiene. And at the end of all of those things is then PPE that then makes the final difference with the smallest of each of those steps. So that approach is really important because that is what will fundamentally help to keep people safe in their care home. Thank you, Tom. We've now got Gareth Accendary from Caerphilly Observer.
Prynhawn Minister. Many people are a little bit confused by the reasoning behind garden centres reopening and now possibly golf courses. Can you explain why somebody's now able to visit a garden centre or potentially play a round of golf, but not, say, meet a family member or friend they haven't seen for maybe a couple of months for a walk?
Okay, so the first thing, we have not lifted restrictions on golf courses. I know some people are calling for it, but there's certainly no lifting of the rules around golf courses as a sector. And if you think about the rules we have, and again, start with stay at home as the basic underpinning, then permissible reasons to leave. At the moment, playing a round of golf isn't a permissible reason, but it's also important to recognise that where people are going for exercise, that there's still the requirement to stay local. So going for a walk a few miles away from your house is local. If you can walk within that couple of mile distance, that's local. What isn't local for the great majority of people is getting into a car to drive to the golf course. And that point about not driving for exercise, that's still really important to understand. With garden centres, there's a point here about both their ability to introduce social distancing, but also that it does help people in terms of the activity that they'll undertake in their own home, because we're concerned with people's health and well-being in all of its senses during lockdown. Now, this is an area where we know that more people are not just interested in gardening, but actually the ability to help people to undertake more of that within their home environment, and it should mean that there's more likely adherence to the broader rules that we have. And garden centres should either be able to operate either click and collect services or indeed the sort of social distancing that we're all now used to seeing in a supermarket, where people have to queue, they have to wait an appropriate distance apart, and then only a limited number of people can go into that environment afterwards. And we expect those rules to be put in place by each of the centres that are now taking the opportunity to reopen. But the garden centre has to be local to you. You can't get in your car and say, if you live in Cardiff, your favourite garden centre is in Swansea, because that isn't local travel. So it really is important to think about all the rules. Stay at home as a starting point, permissible reasons to leave. Then if you are leaving for one of those reasons, you need to stay local.
And then on the rates of transmission, we've seen different rates in different areas of Wales. Here in Gwent, we've seen a particularly high rates, both comparative to Wales and the rest of the UK. As we've already started to see divergence between the UK's nations slightly, what's the likelihood of lockdown being lifted at a different rate in different parts of Wales?
Well, it's theoretically possible, but I don't think it's an approach that we're going to take in the Welsh Government. If we try to lift lockdown in Gwent, for the sake of argument, at a different pace to Cardiff or Swansea or North Wales, I think that'll be very confusing as a message for the public. It'll be very difficult to persuade people that you can behave in a different way in a different part of Wales itself. And I also think there's a risk that you just then have people transferring into an area where lockdown has been lifted first. And that, I think, promotes travel that would breach our current guidance on staying at home and staying local. And you also then potentially have areas where the virus may be circulating at a different level, going into those areas to actually re-trigger community transmission. So the government here is starting from the point of view that measures on lockdown will be taken across Wales at the same point in time, rather than having a different speed at in different parts of the country. And I hope that's helpful about that clarity about a single message for the whole of Wales. Thank you, Gareth. We've now got Andrew Nuttall from The Leader.
So our health board up here in North Wales, the Cynhadledd University Health Board, have said PPE supplies are now available in number for their staff. But we've had a few of our readers get in touch to say that they're sort of confused over Boris Johnson's guidance over face coverings, whether it's for England, whether it's UK-wide. So I think they're taking it with a bit of a pinch of salt after all the recent confusion. So for clarity for those in Wales, sort of where does the Welsh Government stand on sort of covering faces or masks in public? And if people have also asked us about whether if the public are going to start using these masks sort of more readily, sort of will this impact on the supplies for those on the front line? Now that because this announcement was made before, the announcement from the Health Board was made before the announcement from the Prime Minister.
Okay, I think it's really important to be able to address those questions you've raised, Andrew. So the starting point is that what Boris Johnson said is for England only, and it's important that while he referred himself as a Prime Minister of the United Kingdom at various points in his address, the changes made to lockdown that he introduced are for England only, and it's a matter of some regret that he wasn't clearer about that in the messaging. When it comes to face coverings, as I said in my earlier statement, the Chief Medical Officer is going to publish his advice later today to the Welsh Government, and that is that there isn't a strong case, so he's not recommending that face masks should be recommended for use by the public, and those face coverings are not things that should be a barrier to entry into, say, for example, a supermarket or public transport, but it's a matter of personal choice. We know that some people are keen to do so, and already there are people who are wearing face coverings around the country, but we are really keen to make sure that any approach on face coverings does not take away PPE from our frontline health and care staff in particular. We don't want to see that compromise, and it certainly won't be the case that the government will be providing free face coverings for the public. You can do this yourself if you want to, and that's from both homemade and home-provided face coverings to people who are purchasing their own, but we don't want to see a compromise or unnecessary competition for the supply that we need to maintain and secure for our frontline staff.
And sort of touching on the homemade PPE side of things, we've had lots of people here in North Wales, in schools, in factories, and various sort of volunteers groups, sort of all banding together to create this PPE while there has been a shortage. So we were just wondering if you had a message for those sort of people up and down Wales that have been sort of taken upon themselves to manufacture this PPE when the government weren't able to meet that initial demand when the pandemic first sort of hit worldwide.
For all of the challenges that we've faced and will continue to face with the coronavirus pandemic, one of the most positive aspects of this has been the way that the public have responded, not just to the rules around lockdown, but with real altruism to support each other. And actually the manufacture of PPE has been a really good example of that, both from those people who have taken up 3D printing to a range of other areas on a very small, if you like, community level, and indeed the way that businesses across Wales have responded to the challenge of manufacturing more PPE here in Wales to support our health and care system in particular. And I'm tremendously grateful to individuals, to community groups and to businesses that have risen to that challenge to support our health and care workforce in particular. Without that, we wouldn't be in the position that we are. It's really helped us to get through some difficult points at various points in time. But for the future, businesses manufacturing our own PPE for staff in Wales is going to be a key part to what we need to do for many months to come. So I'm really grateful for all those people, in particular on International Nurses Day, to say thank you to the public for supporting our workforce to do their job to help keep you safe. Okay, we've now got Mike Hughes from Global.
Hi, yes, thank you very much indeed. I'm sorry if you touched on this earlier, so you'll have to forgive me, but just given the recent analysis around the increased risk posed to those from an ethnic minority background concerning coronavirus, what should be done to protect those people when they do return to work? And should employers now be prepared to build in additional safeguards in the workplace to protect people from a minority background?
Yeah, and you'll recall that I made an announcement on work that we'd be doing here in Wales to look at issues for people of Black and Asian origin in particular, because the evidence is there that there's a disproportionate impact of harm from coronavirus, whether that's by community transmission or obviously for our frontline staff who are caring for us and the country. So we've established an advisory group, and within that we've got Professor Kishal Singhal, who is a consultant orthopaedic surgeon. He's leading a group on the health and social care workforce and the guidance that they're producing on risk assessment for workers in that particular part of the of public services. But then more broadly, we're of course looking at what that might mean for businesses generally. Now, that work is ongoing, and the difficulty will be for businesses in different sectors what they do to look after their own workforce, and the responsibility employers have to look at risk management as well. So we're hopeful that that group will help to have a more unified message about how we can help businesses to manage those risks with and for their workforce, but obviously for the public that those businesses serve and work with as well. So you can expect to hear more from that group in the coming weeks ahead.
Thank you. And just lastly, just moments before this press conference began, you registered your disappointment on Twitter about a national newspaper planning to run a photo of you out and about over the weekend. Would you like to just clarify where you were at that time? Were you complying to social distancing, and were you local?
The answer is yes to all of those. So I went out for a walk with my family, as many of us have done over the weekend. My son was on his scooter. We went local to ourselves. It's a walk that we can and do from time to time. And we stopped for food on the way. All of those things are within the regulations, so there's absolutely no breach of the guidance or the rules themselves, and it's really disappointing. In the middle of a global pandemic, with more than 1,100 people have lost their lives in Wales and more to come, and difficult, complex choices made every day, to have a deliberately unhelpful inquiry from a journalist, from a national newspaper, who wants to suggest that I've done something wrong when I plainly haven't. I actually think that all of us need to be better than this, because not a single thing that that journalist is proposing to write would help to save a single life, or indeed to help the public with the key messages about continuing to follow the lockdown rules. Stay at home, that's the starting point. If you do need to go out for one of the permitted reasons, then stay local and stay safe. And that way we can get out of lockdown faster and will certainly help to save more lives.